Well, good evening, everyone. I am Misha Maynard, Pastor of Operations at Cathedral Praise Nashville and Cathedral Praise at New Highway. This is usually where Bishop Maynard will come in on Sunday nights and share wonderful words of inspiration, as well as he will share nuggets for us, just giving us information that we need in order to live a better life. He is traveling today, and so he asked me to step in as we deal with COVID-19 then and now. I'm excited to be able to provide this information to you and to share the platform with some other professionals who will give us knowledge and information. And you will have an opportunity also to put your questions in the chat or comments in the chat. They'll come on the screen for us and we'll be able to respond to you. Many people think that we're past the pandemic, but as you know, if you've been listening to the news, those cases continue to rise. Sometimes it doesn't go up because we're not self-reporting, but we know that the response is a little bit different than what it was when we first got started in 2020. And we're grateful for that. But we want to know what to do now. We want to make sure that we're educated. We want to make sure that we're at the forefront of things. And we believe that God's children, God's creation, should have insight and should have knowledge for the things that we're going to be doing. And so that's the reason why today's topic, COVID-19, then and now, is coming to you on tonight. Again, we thank Bishop Maynard for all that he does, his leadership and what he provides for us. And this is one of those great opportunities. So don't be scared. Go ahead and put those chats in there. We'll be bringing some guests out that are experts in this area. And we look forward to a great dialogue and engagement for tonight on Sunday Night Live. And this is on Bishop Maynard's page. The first person I would like to introduce to you is Dr. Shinndana Feagins. And Dr. Shinndana Feagins is the CEO of Feagins Medical Group in Nashville, Tennessee. She is also the board chair of the Hospital Authority in Metro Nashville. She's not only just a doctor and she's not only a board chair, she is a beast. She has a balanced life, a mother, a wife. She knocks it out the park, and I consider her a friend. And she is our director of health at Cathedral of Praise Nashville. We're excited to have her here. Dr. Feagins, would you greet us today?
Hello, everyone.
I'm excited that you are here, and she'll be talking to us a little bit about some of those chronic diseases and how they interface with COVID. And if you all remember, in 2020, she was the first person that we brought on with Bishop Maynard to talk to us about COVID and really enlighten us, because we were hearing so many things on different spectrums of things that was going on. So she'll be sharing some things there. The next person I want to introduce to you is Dr. Angie McGraw. She is a pharmacist, and she is practicing at Nashville General Hospital in Nashville, Tennessee. Dr. Angie McGraw, would you please greet us? I think you're on mute.
Thank you. Sorry about that. Hello. Thank you so much for having me.
Wonderful. I'm excited. Listen, I'm excited to engage with you all to really talk about these things. And I know a lot of people have a lot of questions. As I stated before, there's a lot of things that have changed. I think when COVID first started, we were so scared to do anything. We were walking around with masks on. We would see people driving in their cars with masks on, even though we were like, I wonder why they got their mask on in the car. But listen, everybody just didn't know. Cities were shutting down. It seemed like no matter where you went, you had a possibility of getting it. And so I think there was so many theories that were out there. It was just way out there. And then it seems like we kind of narrowed it down a little bit. We saw a lot of deaths, a lot of hospitalization, a lot of people that recovered, and then a lot of people that still are dealing with it. So Dr. Feagins, can you really shed some light on that, where we were then in 2020 when you spoke to us? I believe it was at the end of April or the 1st of May of 2020, and where we are now in June of 2022? You're on mute.
In 2020, the death rate per day was crazy, really. You had a lot of people dying, thousands of people dying per day. Of course, with the onset of vaccinations and people getting vaccinated, people wearing masks, and medications that have come out since the onset of COVID, those numbers have gone down. We did reach 1 million deaths, which is unfortunate, but the good thing is vaccinations are still the first line of therapeutics to prevent COVID. along with the medications that they have out now that have helped reduce the admission rates to the ICU and hospitals, and as well as the deaths, the number of deaths. So comparing that 2020 to 2022, we've come a long way. We know more about COVID-19. We have medical therapies out there that can treat people within a number of days of the onset of symptoms. And we're reducing the number of hospital admissions and deaths. So we've come a long way.
I believe that as well. And I think even though we reached that million mark for the deaths, and that was just really, really sad, because a lot of that probably could have been prevented. Being someone who's out there just in the line of defense, working on universities and campus and providing COVID testing and tracing and vaccination clinics myself, I do know that some of those things could have been prevented. But what I'm glad to know is there are remedies, there are better responses, such as the vaccinations that you just spoke of. And even if you believe it or not, if you believe in it and got it, or if you don't believe in it, it's really your choice. But we do know it is proven, even those who have who have tested positive for COVID and were vaccinated, their response to it, they were able to recover sooner. Is that what you're seeing, Dr. Feagins?
Oh, people recovering sooner? Yes.
That are vaccinated.
So those who are vaccinated,
Mm-hmm.
who contract COVID, their symptoms are a lot milder. The major variant now is that Omicron variant. Last year, it was the Delta variant that was making people ill, but the Omicron variant isn't as strong in terms of the symptoms that it causes, which is a good thing. But it is more prevalent in our community, and those who have been vaccinated are faring much better than those who have not been vaccinated when they contract COVID.
I think that's important to say that and to highlight that. It's not that you can't get it. We've had breakthrough cases. We understand that, but the response is different. And so one of the things you talked about was the vaccination, but there's also some medication that's out there now that is being used. And so Dr. Angie McGraw, can you share just a little bit more about some of the medications that are out there that are being used now and being prescribed by doctors?
Hi, yes. So now we have an oral medication that is used for treatment. Initially, back then, we didn't have this. So when a patient came in with COVID symptoms having COVID, all we could do was really treat those symptoms. Now we have something that's specifically an antiviral medication specifically to target COVID. So this is not like the vaccine, which is used to prevent COVID. This pill called Paxlovid is used if you have symptoms of COVID and have tested positive. This pill is for adults and children who are at least 12 years old. So again, it's not recommended if we're just doing it for prophylaxis. So this pill is for treatment. Again, it's an antiviral medication for patients who have mild to moderate COVID symptoms. It is a combination pill, and you will take it twice a day for 5 days, and it should be given as soon as a patient has symptoms or has tested positive for COVID-19, and it needs to be given within 5 days of symptom onset. It's also not recommended for patients who have end-stage renal disease or who have severe liver impairment, and if anybody has that type of disease state, you will already know that.
Thank you for that. And I think that's important to know some of the guidelines or the criteria, when to go to get the pill, when to get the medication. But Dr. Feagins, talk to us a little bit about, I've ran into some people who's had COVID, and they said that, there's some long-term impacts or long-term effects that have taken place, like fall brain or some things like that lingering. That they can tie back to when they had COVID, or the side effects from having COVID, and then I'm sure it's combined with some of the other disease states that they maybe find themselves in. So can you just shed a little light on that as well?
Well, that's what we call long haulers, and so there are patients out there who have contracted COVID. COVID affects everybody differently. Some patients get COVID, and after that time period, the 7 to 10 days, they're fine. They're back to normal. But then there are those patients who have chronic fatigue or chronic headaches months and months after they contracted the virus. And so as primary care physicians, we have to treat those symptoms. And sometimes it's a little difficult because the medications that we would generally use, for example, to treat headaches or migraines, they don't always work. And so we constantly having to figure out, okay, this medication didn't work, so let's try this medication. And the patient can become very frustrated, and in some cases, there have been patients who had to battle with depression after contracting COVID. And it's not necessarily COVID that caused them to have depression, but just, like the chronic fatigue and the constant headaches and, just the different long hauler effects of contracting it that can lead a person into a state of depression. And so, as a primary care physician, we also have to help them navigate through that as well. And sometimes medication helps, sometimes just, getting with a psychiatrist or a therapist to talk about it. But it has been challenging, to say the least, just dealing with the long hauler effects and trying to figure out why, there's been patients who didn't have high blood pressure, who contracted COVID. And then after they contracted it, they had kidney problems, which led to hypertension. And, there's some patients who didn't have diabetes after contracting it. And then they all of a sudden, start having, elevated blood sugars and diabetes. So it's an interesting virus that's ever evolving, mutating, and it keeps us as healthcare providers on our toes, and as researchers just trying to figure out how to get this virus under control.
I think that thank you for that information, the long haulers. And I think that's so important because a lot of times people think, okay, it's the 5 days, the 7 days, the 10 days. And I'm going to come back to those days in a minute because I got some questions for you all pertaining to that, how things kept changing. But just thinking that after it's over with, after the symptoms have left, or after you've tested negative, because, if you get those 2 negative rapid tests, then you can go back out into the community. We have all these different guidelines that the CDC has given to us. But there may be some long-term effects. And as Dr. Feagins says, they're called long haulers. So anybody who has had COVID and you're still experiencing those things, just understand that there are some other people that maybe, they're out there like you and it's not unique to you. So you want to talk to your physician. You want to talk to those medical personnel, those medical practitioners. You want to talk to your doctors. You want to talk to your psychologist. You want to talk to someone who can help you navigate through that. So Dr. McGraw, I have a question that's in the chat, and I want to encourage anyone, if you have any questions, go ahead and drop them in the chat. We'll make sure that we get it to you. But we have a question in the chat that says, are there any side effects from taking the medication that you spoke of?
Some of the side effects, of Paxlovid include hypertension, muscle pain, some diarrhea. Some patients also noted taste disorder, like everything tastes sweet or some things will taste metallic. So based on the kind of medication that it is, those are expected. It's also noted that less than 10% of those who are prescribed this medication experienced those side effects.
Okay. Also, I want to just add that there's been some talk about, and you may have heard this too, Dr. McGraw, about rebound symptoms after completing the medications, the Paxlovid, and it may occur like 10 to 14 days. I'm not sure if it's after contracting the virus or after taking the medication, but recently they had been mentioning that you may have rebound symptoms. Of course, they're milder. And the benefits of the medication outweigh the rebound and the symptoms that you may have after taking the medication, but they were discussing that recently.
Yeah, I think that's important. And I'm glad you both have brought those things up because most of the time in our community, when you start telling us there's some new things coming down the pipeline and we need to try it, we're like, I'm not going to be the first one in line to try. I'm not trying that. I'm not going to be it. I'm not the one. So by
Right.
sharing some of this information to make sure that we are educated, that we know what to expect, so that if we do decide to to be a part of this, part of the therapy, or to get the vaccination or to utilize the pill if you get COVID, just the mere fact that we can know that there may be some side effects, so that we're not caught off guard. And I think that's so important. So I told you I was going to circle back. So I did this question. This is just me. I'm sure there's nobody else out here experienced this. But just even being somebody who runs a company that was responding to everything COVID, there were so many changes coming down the pipeline. One day it's 14 days you have to stay in. The next time it was 10 days, and the next time it's 5 days, and it's 7 days. And if you're asymptomatic or if you're symptomatic, it was so much to keep up with. And I know for somebody who's in the field, keeping up with it was a lot. However, I'm sure people who are out here that have no knowledge of healthcare, they didn't go to school for healthcare. They chose not to go to school for healthcare because they didn't even want to be a part of it. But I'm sure it was confusing to them. So if you have any questions out there, I want to encourage you to go ahead and put them in the chat. But maybe you're like me. I want to know, what were all the changes? Why were there so many changes? And I'll start with Dr. Feagins and then jump to Dr. McGraw. Both of y'all can respond to that, please.
It was confusing to me, Misha. I'm a physician. I mean, every time you turn around, the CDC was changing things. I was like, okay, here we go again. I think they were basically, going with what the part of it is probably politics. The other part is going with the information that they had at the time and looking at, case studies and what's going on in the community. And so every other week, it seemed like the mandates were changing. Oh, okay, now we don't need to wear masks if we're in a public place where there's not a lot of people, or if you're outdoors, you don't have to wear a mask. So people got confused. I think people got frustrated with the changes. It made the CDC look like they really didn't know what they were doing. They were just kind of like, okay, tossing, putting their hand in a hat and pulling out, okay, what are we going to do today? So, but I think as time has gone and passed and we've gotten, the vaccine out and people are, not dying at the rate that they were dying back in 2020, the CDC has lifted the mandates and they've kind of relaxed those mandates, in addition to, just people in general getting frustrated and throwing their hands up and saying, hey, I'm tired of wearing a mask. I'm tired of worrying about this virus if it's going to kill me. I've been vaccinated. In some cases, patients are like, I've been vaccinated. I've gotten the booster. I've gotten the second booster. So I got to live my life. So, it's an individual decision. When I go out in public, I'll wear my, especially like at a restaurant, I'll wear my mask. But when, it's time to eat, you got to take it off.
Right.
And I kind of have to gauge it, based on where you are, how many people are there, and how comfortable you feel. I've been vaccinated. I got the booster. I didn't get the second booster yet. Kind of waiting because I got sick on the second shot and the booster. I was even more sick. So I'm kind of like, woo, okay. I can try to get up enough nerve to get that second booster. But I still wear my mask for the most part.
Dr. McGraw?
I won't say that I wear it 99.9% or 100% of the time, but I do wear it.
That's good to know. I'm going to come back to that one in a minute. So Dr. McGraw, your response to that, to the changes, so many changes that took place?
Yeah. And what Dr. Feagins said is true. I believe a lot of it had to do with the climate that we were in at the time, and also the information that we had available about COVID. Wasn't much. What we did know was that as bacteria and viruses are all spread through not washing hands, coughing, being in close proximity, that's how all communicable diseases have spread before, right? So they kind of went with what they knew. What we know is respiratory diseases, just like the common cold virus, just like the flu, if you're in close proximity and you're coughing and you're sneezing on someone, you're not washing your hands, all of that can spread the closer we are. So, initially with wearing masks, that was the appropriate thing to do. Now, the number of days that got to be, as Dr. Feagins said, to her point, got to be confusing for all of us, especially those who work in inpatient healthcare. It got to be very frustrating and very confusing for us all. So, again, I still wear my mask in public. I have traveled. As you know, Misha, I wear my mask when I'm going to be in a place where there's a large number of people, especially in the airport and public transportation. I definitely recommend that you keep your mask on. Again, it is up to the individual person. I am vaccinated and boosted. However, I am around people who are elderly, people who are immunocompromised. I work in an oncology clinic with cancer patients. So I have to be particularly careful about what I'm doing because as we all know, COVID can have no symptoms in some people. So because of that, I choose to continue to wear my mask.
Yeah. So we manage in my business. We manage the quarantine isolation for our universities, and so it got very confusing for us because one day we would put someone in quarantine or in isolation because they had tested either positive or they were a close contact, and then within that same time, within the duration before they were released to come back out or they finished that duration. The guidelines had changed, and so they would notify us, "Hey, listen, I'm supposed to be out." The new guidelines said in 7 days.
Let me out of COVID jail.
Yes, that's what they were telling us to. Let me out of COVID. Exactly. Let me out of COVID jail because it's now only 7 days instead of 10, or it's
Right.
10 days instead of 14, or whatever that may be. And it really got very confusing because we had to write the things up. Of course, we had to write those protocols up and then make sure that everybody was educated. And by the time you seem like you educated all of those parties who, were involved, then we would find ourselves making changes again. So I do understand that. And as far as the mask is concerned, I'm agreeing with you all. I travel a lot, and so I continue to wear my mask, especially on the planes and in public places. And I tell people all the time, and they say to me, "Hey, don't you get tired of the mask?" I'm happy to be able to be alive and wear the mask than to be somewhere else and not be able to be alive. So I'll take the mask and be alive. So that's just my thoughts behind that. And that's what I do. But you can choose to do what you want to do. But I feel like I need to protect myself, but I more so protect others because I am around people who also are, that have COVID or may, we test every day. So I want to make sure that I'm good. But speaking of that, so we're into traveling now. People are moving. And so we're going from country to country. We sometimes even states have changed. So there's different state, guidelines, different country guidelines. What can you advise people, Dr. Feagins? What would you tell your patients? And then Dr. McGraw, what would you tell your patients as they begin to move throughout the country, throughout the world? And we're doing this traveling now. What is your advice to them as far as making sure that they can stay safe, their family stay safe, enjoy their time?
I would say when you're traveling in, like by plane, train, to, of course, wear your mask because you're in a compacted area with a lot of people and you don't know their vaccination status, and you definitely don't know if they have COVID because, you can't be asymptomatic and have COVID. When you're with family that you live with regularly, they live in your household, then, you don't have to wear a mask around them. We're in the summer months now, kids are out of school. You still have to be careful, if you have kids who play sports, like my son plays AAU basketball, they don't wear their mask when they're playing. So, and he's had it twice and he's vaccinated. Every time I get ready to give him the booster, it seems like he gets COVID. So I'm like, okay, look. But, you just kind of have to do what's comfortable for you and your family. Not everybody's going to wear a mask, but if it makes you feel comfortable, then I say put it on, especially if you're immunocompromised or you have a family member or someone that lives with you or that you're in constant contact with that's immunocompromised. Just, protect them, where to protect them. So.
Dr. McGraw?
And I echo Dr. Feagins. When you're in a public place, something like an airport, public transit, on a train, on the bus, however, I highly recommend that you continue to wear a mask in those settings. If you are home with someone that you know is immunocompromised, think about your risk and their risk as well. That is an appropriate time to wear a mask. If you're going to visit someone in the hospital still require you to wear masks in those settings as well. So again, when you're traveling, understand what your risk is to yourself, and then, think about your risks to your family and to others as well.
Well, I'm getting ready to put the $1 million question out there. And I want to encourage you that if you have questions of either Dr. Feagins or Dr. McGraw pertaining to COVID-19 then and now and where we're going, please put those in the chat. They're here to give you guidance, to give you knowledge from their perspective. Both have been out here in the field, and they're replicable in this community. They're known. They've served in other communities as well. And so they're very knowledgeable in this area. But I want to ask you, just from where you are, some of the information that you may have been receiving that we're not privy to. How long do you think we'll be doing this? And is COVID going to ever go away? There's $2 million question. I thought it was just $1 million question. Let me do $2 million question so you can break it up. How long do you think that we'll be doing this that we know, this new normalcy? And then do you know if COVID, or have you heard, will COVID ever go away? So 2 questions that you can tackle and answer. We'll start with Dr. McGraw, then we're going to pivot it over to Dr. Feagins.
So how long will we be dealing with this? I personally think indefinitely. I think that COVID will be one of the viruses that is with us. It will be one of those things that is going to be kind of like the flu. Every season we get our flu shots. COVID just may be one of those things that's with us all the time. It's already begun to mutate. As we know, we've had 3 different strains already. We've had Delta, Omicron, and I think BA 1 or 2 come around. So just like with flu, we had H3N1, H1N1, we had all of those variations come. So I think this is going to continue to be with us as well. As far as the mask mandates, et cetera, I think that is going to continue to be with us and continue to be up to the patient's or person's discretion about whether or not they wish to wear a mask. If we start to see an uptick in hospitalizations and deaths again, I think that we'll be back to the point where it's going to be recommended that we wear masks in public. I think Davidson County has already been pushed back into the high category. So just to be aware of what's going on and surrounding so that we can all make good decisions for ourselves.
Dr. Feagins?
COVID is here to stay. Learn to live with it. It's not going away. Like Dr. McGraw said, it's going to be like the flu, where you get your annual vaccinations. You get one twice a year. So, yeah, it's not going anywhere. It's continuously. That is the smartest virus, I tell you. Mutates. If it had a gender, it'd be a woman, because it's just so smart. I mean, shoot, I call her she. She gets around and she changes the game every time you turn around. She's always 2 steps ahead of us. And, part of that is just people's unwillingness to get vaccinated and, wear masks. So as long as we're dealing with a society that basically wants to do what they want to do, people want to do what they want to do, and they have the right to do that, COVID will be here. We just have to learn how to live with it. So.
Wow. So, and you brought up some things, because we are starting to see an uptick in some of the cases. that are being reported. We were in Florida last week, excuse me, for our Women's International Conference. And while there, as soon as I got back, let me say that I was listening to the news and they said how Florida hospitalization had increased by 40%, and the numbers had gone up. It was like 140 some thousand cases over the last 7 to 10 days. And so I was like, oh my goodness. And we just left there. And I hate to say this, but we had some people who did contract COVID. They did while they were there in Florida. And so we knew about it, but we were able to contain it because we were on site. We were doing testing, we were doing screenings and things like that. So we were able to contain it. It probably could have spread even more. But so what do you say to that? Because the numbers are still going up. It's not like people are not getting it. It's not that people are not reporting it. But what do you say to the people? What are we doing? About this? Do we just continue to do life as we are now, or what's your advice? Either one of you all can jump in and say it, and the other one can pick up afterwards.
I mean, you continue life as it is now. I mean, we've been in this for 2 years, so people are going to do what they want to do and what they feel comfortable with. And there's nothing that you or I can do about it. We just have to make sure our household is in order and do what we need to do to keep ourselves and our family safe. Everyone, they're doing their own thing. I think people have gotten tired of the virus. They're just exhausted, tired of hearing about it. And so they've come to the decision that, hey, just deal with it. If I get it, I get it. Hopefully I won't die. And, hopefully I won't give it to a loved one and they pass away from it. So that's where we are, basically. You can't go around afraid, that you're going to get it. But at the same time, you want to do the best that you can to keep from getting it, at least in my case. Knock on wood, I have not contracted the virus. My daughter hasn't contracted it, nor has my husband. The only one in my immediate family that has contracted it is my son. And I don't know if that's because he was premature, at birth. That could play a role in it, immune system wise, But he's the only one that has contracted it. And even being in the house with us, we haven't contracted it when he's had it,
Wow.
So
it's so unique. I mean, this is such a strong phenomenon. This is just so unique. Dr. McGraw, I don't want to take away from your time. Go ahead and respond.
No, I just was going to echo what Dr. Feagins said. As we've said, COVID is here to stay. So, you have to build your lifestyle kind of around that. You can't stop living. You can't stop interacting with the people that you love. And it's true. I think people have got COVID fatigue, literally and figuratively. They're tired of hearing about it, tired of wearing the mask, tired of protocols that change so quickly, tired of new variants, So just trying to do what is best for your family, trying to make informed decisions about, what's the risk out there? What do I need to do then based on what the new risk is? Do I continue to wear my mask or not? These are things that the individual person needs to make, and hopefully they make that decision based on facts and well-informed and are well-informed about it.
Yeah, but we are constantly reminded that it's here. I mean, it changed so much. Restaurants that you used to go to that are closed down, or, just places that you go that aren't open every day because of the staff shortage, or, we're constantly reminded of it just in our daily activities and walk of life, but it's here to stay. So
yeah, we have a question that you talked a little bit about the long haulers, but how long does the coughing last after having COVID, and is there anything that helps it, Dr. Feagins?
Everybody's different.
Okay.
Some people it lasts 2 weeks, some people it lasts a year, some people last longer. So, COVID affects everybody differently. and that's it does. You know, some medications work for people and they don't work for other folks. You know, so you kind of have to play with it as a physician. You know, I may prescribe you Tessalon pearls and it may help, but it might not help the next patient. So Robitussin over the counter may help one patient and it doesn't help another. Another patient may need, you know, the codeine, the cough medicine with codeine in it. So
do you just recommend they talk to their physician maybe and let their physician know that they're experiencing this cough and how long it's been there? And so maybe that will help you out there. Renetta Dotson put on there, I know you asked about that. You can't find your card. You can go back to the health department and the health department will be able to get you a new card. They can issue a new card. I know that for a fact because I had to issue new cards myself and I was working with the health department. So if you want to go to Davidson County, if that's where you are, whatever your county health department, you can go there and get a new vaccination card. They'll put the dates on there. I don't know if I hope that there's no cost for that, but they should be able to pull you up in the system and be able to give you that information. So that they can mark that down on your card, so you can have that, and that way you can get your booster, or if you want to continue on with the vaccinations, that's great. So I do want to give that information there to you. That's awesome. I think that's what you all are talking about. I think is so important that about the fact that we have this new normal. We are reminded of it every day. I was kind of laughing when you all were talking because even nowadays, like when I go, I don't have like certain group of people that I kind of go out with or that I hang with or that I talk with. And then when someone new says, hey, let's go do it, I'm like,
have you been vaccinated? Look, we all have over the last 2 years got our bubble of people that we hang out with that come over to the house or we go to dinner with or we do activities with. And it's just a small group of people. And then when some more people come in, you be like, have you been vaccinated? You know, and I'm not afraid to ask. You know, we used to have a Christmas party at the house every other year.
Yes.
And we had a Christmas party last year, for the first time. And I guarantee you, everybody that came over had to show their vaccine card with their booster shots. Mm-hmm. So, and I was not ashamed to put that in, hey, that's your admissions ticket, And so, and no one contracted COVID. I have been very blessed.
Right.
I just follow protocols. If I have people, the only people that come to my house are vaccinated and boosted.
And I think you have to do that. And someone laughed at me because I was with one of my team members and we were traveling, which anytime we get ready to travel, we, of course, always have to test beforehand. We test while we're traveling because we want to make sure that, because we're usually in the face of people. So we want to make sure that we're not passing it on. We have our mask on. We do all those things that we need to do to practice all the guidelines and protocols. But I was laughing because she sneezed or she did something. I said, did you test today? I mean, the first thing came out of my mouth was, hey, did you test it?
I remember a time when a person would sneeze or cough and you didn't give it a second thought. Now it's like,
right.
Can you at least cover your mouth? I mean, like, really? And these people will be coughing and not covering their mouth, at least, and they don't have on a mask. And it's like, and then you want to ask them, are you vaccinated? Right. Not that it really matters because you still can contract it, but still. Exactly. You sitting up here coughing. Ridiculous.
I tell you, the worst is on the planes now. When we're on the planes and I have my mask on, but I'm telling you, when I hear somebody that coughing, their chest is heavy, and so I be like, oh, you got COVID. I be want to pull my test out my bag because I keep them in my bag. I want to pull my rapid test out my bag and just tap them on the shoulder. Hello, read the flight attendant bell and say, listen, pass that up to the person that's doing all that hacking.
No, listen, we were on a flight. I can't even remember where we were going. This lady was coughing. And she was sitting like on the other aisle, maybe one aisle up ahead of me, right? And everybody walked past her, didn't want to sit next to her. And it was her husband was on the window seat. She was on the aisle seat, right? So I'm like looking at this lady like, The nerve. And I have my mask on. And that's when it was a mask mandate on the planes. I glimpsed at her once everybody was seated and they were shutting the door. This woman was faking. She gets her phone and starts texting. And she said, yeah, I was and I can read her text message. She was like, yeah, I was coughing. I don't know who she was texting. And so the people wouldn't sit next to me and it worked. I was like, that's smart. But I was mad though, because I was like, if this woman don't stop all this coughing, I mean, like, really get off the plate. I'm looking at her, giving her the side eye, like, now you know better. I wanted to ask her, are you vaccinated? Because you sure are doing a lot of coughing. Then when I saw that text message, I said, oh, that was her ploy to keep people from sitting next to her and her husband. Okay.
Right. And that you do know people probably doing that, but I'm talking about the real people that you hear it. And okay, so Linda Coakley asked, can vaccinated people get COVID? And I think we've answered that already.
Yes.
It's called breakthrough cases when they do get COVID and you are vaccinated. So it's called breakthrough cases. So yes, you can. But
the symptoms will be milder in most cases, though.
Okay, that's good. So symptoms will be milder. As Dr. Feagins said, in most cases. So of course now we've gotten past all of it's not the serious. All this is very serious, but so now we're just talking about behavior right now because I'm laughing when the people pull their mask down, Angie. The people pull their mask down, cough, and then put their mask back up. Okay. So speak to it, Angie. Speak to Dr. Angie McGraw. I'm sorry. It's Angie to me. I'm got real relaxed now. Misha, Shinndana, and Angie, but go ahead.
Well, of course, that defeats the purpose, right? Of having a mask in the first place. When we have on our mask, please put them over the nose and the mouth. Put them snug. It has a little adjusting bar there. Whether you have the N95 or whether you have the little blue surgical mask, they should all have the little adjustable bar. It should be nice and snug. You should be not pulling it down. If you're going to wear it and have it be as effective as possible, it should only be pulled down to eat, drink, things like that, not to cough, not to sneeze, please. If you have to cough or sneeze, please continue to cover your mouth. I still, with my mask on, if I have to cough or something, I still turn my head and cover my mouth. So, and wash my hands after, because we want to keep down spread as much as possible. So yes, pulling down the mask completely defeats the purpose of having it.
Stop wearing it as a chin guard. It's not protecting your chin, and it definitely ain't protecting everybody else from getting what you got. So pull it up.
The cloth masks have been proven to be ineffective. Please, I know the new designer masks, they're so pretty and they put all kinds of prints and all that on there, but they are cloth. Cloth materials hold things, especially if you don't wash them. They can get saturated, etc. So please use a mask that has been approved that is not cloth.
Not cloth and with rhinestones and things like that on there. I'm not going to call anybody out, but our church folks, we like the rhinestones and bedazzle our mask and everything. So
well, you can wear it over a surgical mask if you just want to be bedazzled and,
Yes. But please do not wear it alone.
Yeah, don't wear it over a surgical mask or an N95 or a KN95, if you just don't want to wear it.
Right. Okay. So you brought up a question. Brought up a point, and you said this earlier, and I wanted to circle back to it. So I'm sure a question as well that nobody's asking. I'm going to ask all the questions everybody's been asking me. So that's the reason why I'm putting it out here. So you take it down to eat and drink, and you put it up. So what's that? What's that all about? How come it's okay to have it down to eat and drink, and you have to have it up to wear it? So can you speak to that? Because I'm sure there's got to be somebody out there that's asking this question.
How you gonna eat with a mask on or drink?
I'm just saying though. I'm saying
in the mask.
I'm just saying to you, if I take it down to eat and drink, and I have it down, then what's protecting me in that moment?
There's nothing protecting you in that moment.
Okay, all right.
But you got to eat. You got to drink. So you just take your chances basically when you're, doing that. Some of the restaurants still have those barriers up between like the seating areas. So that helps. But you just have to take your chances,
And we're also hoping that while you're eating and drinking, you're not coughing your
Right.
your food and spitting food on people, et cetera. Excuse me for the visual, but we're we are hoping that you're within your own radius while you're eating and drinking, and you're not that way spreading bacteria the way that you would if you're coughing or sneezing. You're not propelling
Respiratory droplets.
Exactly.
So, and I think that's important that you said that, because I've heard people ask, or people made the statement of, why I don't wear a mask when I eat and drink, so why should I wear a mask, period? And so I think that when you speak to that, to let people know that it's not going to stop you from getting, COVID. The reason why they say it is because you can't eat and drink with your mask on, but you're taking your own risk when you pull it down. And the reason why I say that is too, is I'm on the plane. Sometimes most of the times I choose not to. I choose not to take the snack. I choose not to, or I'm like Dr. McGraw. I'm turning over to the window if I don't know you and I'm sipping on the by myself, because I don't want to catch anything if I'm just that thirsty. But most of the time I just never mind. I don't, I just won't have it at this point in time. So someone asked the question, why have they relaxed the mask mandate? So can both of you all speak to that from your own perspectives? Why do you think that they relaxed the mask mandate?
I think they look at the data of what's going on in the community to determine, if the numbers are low, and if they're dropping, then based off of that, and they look at, the number of cases, hospital admissions, the number of people contracting the virus. And so they base it off of that to determine whether or not to drop the mask mandate.
Mm-hmm. Yes, it's dependent, as Dr. Feagins said, on the community data. It will be different from each county that you go to based on what's going on in that county and what the health department or the city council in that area has decided based on their numbers.
Good. Then that's it. That's important. It's also important as you are traveling and moving about and coming back to some sense of normalcy that you do check and see, not only just from county to county, state to state, but also when you go to other countries, because other countries have different guidelines and protocols. One of the things that was interesting, because I did travel internationally when I think in 2021, and there were more restrictions in overseas than it was here in the United States. It was more restricted there. When I say that is, when we arrived, you had to have your mask on. We were at a resort. You could not walk around without your mask on. You could take your mask down when you sat down to eat. But when you were moving about throughout the resort, you had to have your mask on, and they would come and find you and give you a mask. Like, they had these trays they were carrying around with these tongs, and they would hand you a mask so that you could put that mask on. They were very adamant about it. It was systematic, and it was great. I thought that meant that everybody over there bought into the fact that we had to keep, the place safe. And I'm sure it's because tourism was, the number one revenue driver. So they had to have that in. But the funny thing was, going in, you just had to show, think that you had to, maybe show that you were vaccinated to get into the country. But coming back over the United States, you had to have a negative test. And then the United States, of course, was so much more relaxed. And it was just kind of funny how the different protocols, they're just, they're varied depending on where you're going. So I think that's important to know as well as you begin to move out. Go and check your numbers. Every state, every county has their dashboard up. You can check that usually at the health department, and find out what your COVID case levels are. Find out, how, are they on the rise? Are they up any percentiles? You can check into these things too, just as much as you check the weather. I think you need to check the COVID status as well. So you're checking for all things to make sure that you have a healthy and wholesome and a safe time if you're leaving out of your quote unquote bubble. So we just have a few minutes left, and I want to throw it back to both of you all. If you want to share something with the audience to let them know as we get ready to close this session out, if you want to just to leave them with something as they go forward into the beyond. So we've had COVID-19 then and now beyond. So we'll start with you, Dr. Angie McGraw, and then we'll go to you, Dr. Feagins, and then I'll wrap it up.
I just reiterate, please know what your risks are. If you are with someone or living with a family member who is immunocompromised, who's elderly, who would be at high risk for contracting COVID. If you came in and were asymptomatic, please be conscious of that. In public places, please consider wearing your mask, especially if you're in a place that's a high volume, like an airport or a bus station. Please consider putting your mask on to keep yourself safe as well as your family members.
And I would just piggyback off of that, just recommend that everyone get vaccinated if you haven't gotten vaccinated. They do work to prevent, or shall I say, to reduce the risk of death and hospitalizations. And if you've been vaccinated and you hadn't gotten your booster, I would recommend getting your booster as well, because there's, we don't really know how long the immunity lasts from the vaccination. It varies from person to person, but 3 to 6 months. So it's important to get the booster if you've been vaccinated. And if you haven't been vaccinated, I would say get the vaccination. You can either get Pfizer or Moderna. Those are the recommended vaccines. And someone had asked the question, can vaccinated people give you COVID? Vaccinated people can contract COVID. So yes, you can get COVID from a vaccinated person if they have COVID. I can't hear you, Misha.
You are absolutely went off on mute, and I read the question incorrectly. So it said, can they give you COVID? So thank you for clarifying that, Dr. Feagins. Yes, that they can give you COVID if they are vaccinated. So yes, as you said, if you have it, you can transfer it.
more reason to wear a mask when in close knitted settings.
I agree. Well, I want to thank you both so much for your time. I want to thank you both for just being out there in the healthcare industry. As we know, there was a lot of stress and strain on all of our practitioners who were out there, who were fighting COVID from the day one. A lot of it was, as they say, they were building the plane as they were flying it. And you all were out there on the grounds, boots on the grounds, making things happen, making sure your patients were safe, making sure the community was whole. And we want to say thank you. We want to applaud you today and just say thank you so much for doing everything that you can do to make sure that our community stays safe, healthy, and whole. And I want to say also, just as a pastor, as a minister, we want to say thank you as well for educating us to make sure that we are knowledgeable of what's going on. We are not only concerned about the spiritual man, but we're concerned about the physical man and the mental man that occupies all of us. We're a triune being. So we want to say again, thank you so much for all that you do. And then to those people who chimed in today and joined us in this conversation, thank you so much. Normally Bishop Maynard would be sitting here. And so he tapped me and said, Misha, you can carry on for me. And so I appreciate him trusting me to carry on this dialogue. So thank you all so much for sticking with me for these 50-some minutes, and I appreciate you all so much. I want to encourage you all to continue to do your research, continue to stay connected, continue to learn more about what's going on with your health. You are responsible for your health. These wonderful, beautiful ladies will tell you that you're responsible for your health. It's you. You're responsible for it. You need to ask your doctors questions. You can ask your pharmacist questions. They want you to engage them and ask them questions so that you will know. Dr. Feagins happens to be my doctor. She is my PCP. And so when I go to her, ask her questions, I'm going to tell on her and I'm going to be transparent. The last time I was there, I asked her about this little spot that I was having on my waistline, and she told me it was a fat bubble, and I about just died. I'm telling you, I've never seen such before in my lifetime. Clutch pearls. I'm still trying to get over the fact that I have like fat. And so I'm trying to work on it. Dr. Feagins, I started exercising. I've been eating differently. I'm doing all the things I need to do because I'm about to fall out. The fact that FAT came out of your mouth.
I did not say fat bubble. I said lipoma. That's the
lipoma.
Lipoma.
A fat pocket.
Adipose tissue.
It's a fat pocket. And what was it called? She said full of fat. I said fat. Oh my goodness. Such
I
pearls.
don't think I was that cruel. I was just, I said, hey.
I called all the prayer warriors, and they have been travailing on my behalf ever since. That God would deliver me from that whatever that
The
is.
fat bubble, huh?
Yes, that fat pocket, fat bubble, whatever you want to call it. But anyway, but I say all that to say that I feel very comfortable with her to ask her what's going on with me, and she's able to address it immediately. And so I'm very grateful for that. And as you all know, Dr. Angie McGraw, she provides our COVID testing at Cathedral Praise each Sunday for our musicians and our singers, so that as they're projecting, we make sure that they are safe and that they are healthy and whole as they minister the gospel. So we thank you so much for all that you do. Thank you again, audience, for joining in. We look forward to seeing you all on next Sunday night. Bishop Maynard will be here to share those golden nuggets with you, those words of wisdom, as he does every Sunday at 6 p.m. at Sunday Night Live. Until then, I want you all to make sure that you stay healthy and whole, be blessed, and make sure that you stay educated in all areas of your life. Have a great rest of this week. We'll see you later. Bye-bye.